Good evening, everyone, and welcome to today's wonderful evening. Extremely sorry to start this late night class, but little time, let us meet, study together. From tomorrow, we'll try to have a little longer class, most preferably from the classroom. So just bear with me for my delay. So today we will have 30 to 40 radiology questions, which were in the recent AIMS and INICET exams and the previous year question paper. So instead of the regular theory, high yield facts, let's do a little bit of MCQ revision. That's the plan. So is my voice audible for all of you? Kistiji, Pachauri, and many more who are all online. Can you please punch? Is the voice loud and clear for all of you, doctor? It's a brief session, very brief session we'll try to have. I hope I'm audible to everybody. Very good. Loud and clear. Thank you. So, doctor, why are the hydrogen molecules are ideal isotope for MRI? Because they have high tissue density. Tissue has molecules, molecules has atoms, atom has the protons. High spin density, high magnetic resonance sensitivity. So that all makes protons the ideal isotope. Whenever there is any lateral disc herniation at L4 to L5, nice to see Dr. Madhu, Bobby, and many more. Keep punching your answers, doctor, so that parallelly we keep mention the question number and your answer, question number and your answer, so that you are parallelly active. Instead of being a passive listener, you are more an active listener. So that is the whole purpose of this session. So whenever L4, L5 radiculopathy, disc herniation, there is a L4 radiculopathy is what you need to remember. So about even spinal nerve scores above the pedicles for which they are named. For example, there is a C8 nerve root, but only a C7 vertebral body. Below T1, spinal nerve cores below the pedicles for which they are being named. So, whenever there is any paracentral disc herniation in the lumbar area, it typically strikes the root which is exiting below the interspace. That is, the disc space is inferior to the exiting root at that level is what you need to remember. For example, L4 vertebra, L5 vertebra. Then typically it is the L4 nerve root, which is the one which is typically compressed by the disc herniation is what you need to remember. So this is how typically the paradiscal herniations occur. So any L4, L5 disc herniation most often compresses the L5 root is what you need to remember. Now, in neurofibromatosis, what is the cause of pulsatile exophthalmos? There is something called sphenoid wing dysplasia, which will lead to the development of you can see orbit is much anterior over here. So, pulsatile proptosis, pulsatile exophthalmos is what you typically see. Now, Mahalakshmi says, sir, please make the class early. You are right, Mahalakshmi. I too believe that early to bed, early to rise is always a good policy. But somehow I got cluttered with so many meetings today morning, end to end. So before going to sleep, I thought, let me bid a farewell with at least an hour class or a 45 minutes class with some MCQs, right? but our actual regular sessions start from almost 17th or 18th onwards. Our RTC Crossroads near Gandhi Medical College, the center is getting ready. A lot of students are enrolling, so all of them come to the class, and we'll have a live class in the Hyderabad, which is live broadcasting. So we will try to be early. But till September 20th, I still want to keep floating along with you, so that I want to keep you continuing to prepare. So that is the reason before going to sleep, I love to spend a 45-minute class with you, right? I apologize for the delay. So doctor, what is the etiology of subclavian steal syndrome? Punch your answer. Keep punching your answer. So subclavian stenosis proximal to the origin of the vertebral artery. So you are having left vertebral artery, left subclavian, right vertebral artery, right? So typically subclavian steal syndrome occurs because of the stenosis of the subclavian proximal, proximal to the origin of the vertebral artery is what you need to remember. So whenever subclavian stenosis is proximal to the origin of vertebral artery, it steals the blood from the cranial circulation into the arm whenever you are doing exercise. Whenever you are doing exercise, the circulation supposed to go to the brain will be stolen so that it is supplied to the arm. So that is a whole problem. So you can see the two vertebral arteries typically form the basilar artery is what you need to remember now. Why arterial layer composes the wall? I mean, which arterial layer composes the wall of the saccular aneurysm? It is the intima and adventitia. Intima and adventitia that compose the wall of the saccular aneurysm. Atomic weight is equal to proton and neutron is equal to the atomic weight. Which cell is sensitive to radiation, doctor? Lymphocytes are very sensitive. Platelets are most radio-resistant to radiation is what you need to remember. Which contrast you use in barium enema? Barium sulfate, not sulfide, is what you need to remember. So what is the optimum distance which is used in chest radiography, doctor? It is 180 to 190 centimeters. Almost 2 meters. Distance need to be maintained in chest radiography examination. So typically we use 80 to 120 kV with 6 feet, 1.85 meters, which reduce the magnification and produce a sharper image is what you need to remember. Now, very nice to see 14 online classmates. I hope the voice is loud and clear for all of you. Now, Eisenmenger syndrome is characterized by what? So, typically what is Eisenmenger? There is a development of pulmonary hypertension which will cause an increase in the pressure in the right ventricle, leading to increase in the pressure in right atrium, leading to the reversal of the shunt across the ASD and VSD from right into left instead of left into right is called Eisenmenger. So fundamentally there is a pulmonary hypertension. So what are the signs of pulmonary hypertension? Already we discussed. Pruning of the peripheral pulmonary artery and dilation of the central pulmonary arteries. Return of left ventricle and right ventricle to normal size. So these are all the facts which you see in Eisenmenger is what you need to remember. So once there is a pulmonary hypertension, the pulmonary artery is enlarged, and peripherally, normally there are a lot of branches of the pulmonary artery. There is a peripheral pruning, it's called as peripheral pruning. In the periphery, you are not finding any pulmonary artery shadows. Peripheral pruning is the characteristic feature of pulmonary hypertension, is what you need to remember. Now, nice to see Atul Sharma all the way from Nagaland. Very good, doctor. Now, barium study in Trendelenberg position is done for what? It is done for hiatal disorders. So whenever any hiatus is there, then typically if you do barium in a Trendelenberg position, then the herniation will become much more obvious, is what you need to remember. Unilateral, small, smooth kidney. Small, smooth kidney, where do we see? Whenever there is any renal artery stenosis, typically there is a unilateral, small, smooth kidney is what you should remember. So what do you see here, doctor? Stenosis, renal artery stenosis. Whenever it is there, the kidney becomes smooth and small compared to the normal kidney, whose renal artery is very well perfusing the kidney, is what you need to remember. So what are all the causes of unilateral small kidney, doc? Reflux nephropathy, renal artery stenosis, any infarction, post-obstructive atrophy, post-inflammatory atrophy, multicystic dysplastic kidney, they're all the causes of unilateral small kidney, is what you need to remember. So, I want to once more tell you, in the SCORE learning app, today only download the app, doctor. You have 1200 pages notes, which has 50,000 high yield facts. All these PowerPoints after the session will go into the SCORE app. Already there are 600 hours of video containing 10,000 short videos. 10,000 short videos is available, and also 100 full-scale grant tests with discussion, live discussion, and 40,000 previous year questions, question bank for practice. Everything is offered for just 5,000 rupees. Additionally, you also have a live online class every day. Live online class every day. 24/7 WhatsApp support is available. Anytime you get doubt, WhatsApp me. I love to help you out. So just for rupees 5,000 today only, subscribe to SCORE Learning App coaching program for the NEET PG and INICET. Now, widespread patchy sclerosis of the skeleton. Where do you see that? We see whenever there is any carcinoma breast, fluorosis, mast cell reticulosis, all this lead to widespread patchy sclerosis, patchy sclerotic lesions, is what you need to remember. A patient has ectopic kidney. Adrenal is most likely to be located where? Obviously, ectopic kidney also, adrenal is still there in the normal position. Because the development of kidney and adrenal is suprarenal gland. Even if kidney is ectopic, adrenal will be still in the normal position, is what you have to emphatically remember for the tomorrow's exam. Craniosynostosis. What is it because of? Sagittal, coronal, lambdoid, any of them undergoing fusion will lead to craniosynostosis, is what you need to remember. Now, what is most commonly used for the treatment of early carcinoma of the vocal cord? So, typically we do radical radiotherapy, doctor. Radical radiotherapy. So, what is the commonest site for the nasopharyngeal carcinoma, doc? Fossa of Rosenmuller. This was asked in 2023 NEET PG exam also recently. And radiotherapy is the standard mode of the treatment, which yield about 50 to 70% survival, is what you need to remember. Once more, in the nasopharyngeal carcinoma, keratinizing type is least radiosensitive. Undifferentiated is most radiosensitive. That's what you need to remember. So what is the best imaging modality? Whenever a patient is having breast implant, doctor, MRI scan, for the typically the breast implant, whenever is done, MRI is preferable for the assessment of the breast with implant is what you need to remember. And breast implant obscure a significant part of breast tissue. And also mammography will not be able to identify the lesion in this augmented breast is what you need to remember. Whenever mullerian duct anomaly, what is the most important investigation to carry out, doctor? Always mullerian abnormalities are associated with genitourinary. Even urinary system is affected. That's the reason intravenous pylography is considered to be the investigation. In the case of mullerian anomalies is what you need to remember. Now, uncomplicated chronic pancreatitis, what do you see? This we recently discussed. Calcification, duct dilatation, gland atrophy, they are all the features of chronicity. Whereas necrosis is a feature more of an acute pancreatitis is what you need to basically remember, doctor. So what is the potential difference between an X-ray tube applied, the potential difference applied to a X-ray tube, if it is increased, what will happen? The intensity increase, So KVP, intensity is proportional to square of the KVP is what you need to remember. So KVP and MA, the quantity of X-rays depends on the atomic number of the target, KVP and MA, milliamperes. While the quality depends on KVP only is what you need to remember. During radiotherapy, the buccal mucosa exhibits radiation reaction before skin. Why? Because there is a rapid cellular turnover in the mucosa which lead to the development of radiation reaction before skin is what you need to remember. What is most fat soluble out of all this, doctor? Myodil. Myodil is an oil-based contrast used in myelography, but nowadays it is not used anymore. So we do CT myelography occasionally when MRI is not available. So that's what you need to remember. Myodil is the one which is fat soluble, oil-based contrast media is what you need to remember. Keep punching the answers, doctor. These are all the questions based on our earlier 6 days of radiology high yield fact class. Okay. So tracheal bifurcation, what is the best standard view? It is the left anterior oblique, lavo. So if you want to see the bifurcation of the trachea, tracheal bifurcation is called Karina. Karina Kapoor nahi, Karina Kapoor. Karina. It is not visible on lateral X-ray. It is better visible on left anterior oblique view is what you should remember. So what constitutes the left heart border, doctor? Pulmonary artery. Pulmonary artery is the part of it, right? So this is the right paratracheal strip. This is the aortic knob. This is the pulmonary trunk. This is the left atrial appendage. And this is the left ventricle. This is the right atrium. This is the interlobar artery. And typically you have the ascending aorta in this area, ascending aorta. And here you have the inferior vena cava. So if you look at the right ventricle, where is it? Right ventricle is all anterior. It is all anterior. It does not form the borders. Similarly, left atrium, only you will find left atrial appendage. But if left atrium enlarges, it enlarges like this, so that typically it forms a shadow within the shadow appearance is what you need to remember. So, doctor, it is not a single coated film. X-ray chest film is not a single coated. It is a double-sided emulsion coated is what you need to remember. So what is the main advantage of transesophageal echocardiography? So if you use transesophageal, you can identify the thrombus can be easily identified within the cardiac chamber, right? Normally, these thrombi embolize and go to the systemic circulation and lead to hemorrhagic strokes. So whenever there is any hemorrhagic stroke, you should also do a 2D echo to identify whether there are any thrombi within the cardiac chamber is what you need to remember. So this is the left atrium appendage, and here you can see the thrombus is what you need to remember. So whenever you look at the heart, the posterior structures like pulmonary veins, atria, appendages, AV valves, they're all especially imaged with a transesophageal echo. So typically the esophagus is a posterior mediastinal structure and you have the heart. So the posterior structures of the heart are better visualized with the camera in the esophagus, which is visualizing posteriorly. The EEG cabins are completely shielded by a continuous sheet of wire mesh of copper. And what is the shielding effect is called as? It is called as Faraday's cage. So what is this called? Faraday cage is a continuous sheet of wire mesh of copper and aluminum to shield the EEG rooms and cabins is what you need to remember. Now, doctor, what is the most radiosensitive tissue in the body out of all these? It is a bone marrow which is most radiosensitive is what you need to remember. Sorry. Bone marrow. Whereas the bone is most radio resistant, but the marrow inside it is most sensitive is what you should remember. So now, doctor, what is the maximum permissible dose in pregnancy? 0.5 rem is the maximal permissible dose is what you need to remember. 1 minute, doctor. Somewhere the sound is sticking. One minute, doctor. Somewhere the sound is coming with a slight transition. Okay. Yes, sir, the clicking sound. So give me a feedback, doctor. Are you enjoying more of this MCQ based quick review, or do you want high yield fact based review? Which one is your preference? Please let me know, right? Which one is more high yielding for you? MCQ based review or the high yield fact based topic wise, the paragraph wise of our 1200 pages notes? Is that more helpful and high yielding, or this is more high yielding? Please let me know, right? So there you get a kind of a satisfaction. In the case of high yield facts are finite. Totally 50,000 high yield facts are there in 1200 pages notes, which I have given to you. बराबर, वो पढ़े तो रिवाइज करे तो खत्म. That is always good. Monish Chandra is saying less theory, more MCQ is much better, sir. Okay, point taken. MCQs में क्या होता है ना डॉक्टर, MCQs are infinite in number. उसको इतना नंबर बोल के हम सीमित नहीं कर सकते. बट MCQ में अगर आप how you are able to implement your knowledge for that, MCQ is good, because ultimately exam is MCQ, right? So we'll try to strike a balance between the two. No problem. So doctor, maximum permissible radiation dosage is 0.5 rem, which is a contraindication for MRI. Also, please give a feedback. Is the speed okay? Is speed okay? Or shall I go slow? Or shall I go slow? Please give a feedback. In the chat window, is speed okay? Or shall I go slow? Let me know. So, which is a contraindication for MRI? Always a pacemaker is a contraindication. It's an absolute contraindication for MRI. Earliest feature of the radiation toxicity क्या होता है डॉक्टर? Erythema is the earliest. Rectal mucosa is damaged above how much radiation? Above 8,000 rats. Rectal mucosa is damaged. So 1 gray is equal to 100 rats. Typically, whenever you are treating carcinoma cervix, maximum dose limit during interstitial brachytherapy for rectum is 70 gray, for vagina is 130 gray. 1 gray is equal to 100 rats. That's what you need to remember. Speed okay. Thank you. Thank you, Atul. Subhash, nice to see you. Sir, speed is okay. Very good. Thank you very much. Radiation mainly causes cataract. Which kind of cataract? Posterior subcapsular cataract. Right retrocardiac space is best seen in which view? So you have the heart. So retrocardiac space on the right side, how can you see? So you need to do right posterior oblique view is the one which is preferred. So this is the anterior oblique projections. The side of interest is the side further from the cassette. Suppose this side you want to check, cassette should be placed here. Cassette should be placed here if you want to check this side. So this is typical anterior oblique projections, which are the best way by which a retrocardiac space can be better looked at. So the retrosternal space is best seen in lateral view, while the retrocardiac space is best seen in oblique view. Retrosternal is different from cardiac, doctor. So you are having sternum, these are the vertebrae. Lateral view, let us take. So typically you are having the heart. So retrosternal versus retrocardiac, there are two different things you need to be sure about. Retrosternal is best seen in the lateral view, but retrocardiac is best seen in the oblique view, is what you should see. X-rays are least sensitive to which colored light, duct? Red. So X-ray film is least sensitive to red light, and if sensitizers are added to X-ray film, you can extend the spectral response up to green, is what you need to remember. So what is the investigation for a recurrent GIST, doctor? GIST is gastrointestinal stromal tumor. So it is the FDG PET scan, fluorodeoxyglucose PET scan is the best way in order to make the diagnosis of the GIST tumors, is what you need to remember. So where do we use FDG PET, doc? Whenever there is an unknown primary lesion, you want to assess the residual or recurrent disease after a primary therapy. You want to look for the synchronous metachronous primary lesions. We use the FDG PET, is what you need to remember. Very nice to see 19 online classmates. Right now, Midnight Masala with Dr. Murli Bharadwaj. So, doctor, it is all, remember that winning entrance exam or winning a war, it's all about perseverance. Those who is able to fight longer, wo jeetega. Hustling, hustling, hustling. I know some of you are very sleepy in the midnight, but still, I love to stretch you a little more to tell you that you have a great potential to become a winner doctor. Let me tell you. Okay? So, jo dar gaya, wo mar gaya. That is the rule in the NEET PG preparation, doctor. I am promising you every day I will be there. At least 1 hour minimum. Whenever time is there, 3 to 4 hours, we will have a class. But हम रोज मिलेंगे, रोज पढ़ेंगे. Please be part of our WhatsApp study group. I posted the link below. Please join through that link. If you are not already there in any of our other groups, please share this link to all your friends. So let us meet, study together. See, now 60 days लगता है NEET PG, I mean INICET. 20 days before, oh my God, it is only 20 days lagta hai. But it is we who are reacting to the time. Time is same, right? So, already NEET PG, you finished the exam. You already reached almost 70 to 80% level of completion. Why to unnecessarily wait for results? Continue studying. May not be about 8 to 10 hours, at least 4 or 5 hours पढ़ो. इतने में रिजल्ट्स आएगा, रिजल्ट्स आए तो भी टेंशन नहीं रहेगा. सीट आ गया तो भगवान की कृपा, नहीं आए तो INICET के लिए आगे बढ़ना. That is how we need to lead the life without looking back, without waiting for something. That is most important thing I want to tell you. All right, doc. Anyway, I am there, your classmate, to study with you every day, right? So, doctor, post-radiation transverse myelitis. It usually presents at what time after radiation therapy? But typically it presents after 1 year. Post-radiation transverse myelitis. The thickness of the lead apron to prevent the radiation in radiology department is how much? 0.5 mm. Lead aprons. Radiation protection shields, what are they made up of? Lead is what we need to remember. Secondary type of radiation means what? So whenever the radiation hits the patient now, so there is a scattering. That scatters on contact with patient is called secondary type of radiation. Primary radiation passes through the aperture is what you need to remember. Radiation exposure during infancy is linked to which carcinoma, doctor? Typically, it is the papillary carcinoma. Papillary carcinoma among the thyroid carcinomas. Typically, radiation exposure is being linked is what you need to remember. With regard to the contrast, MR contrast material, you need to remember gadolinium is a paramagnetic substance. Gadolinium is chelated with DTPA, which allows safe renal excretion. A rare complication कभी कभी अगर आप gadolinium contrast का इस्तेमाल करें तो क्या होता है? Nephrogenic systemic fibrosis can occur with gadolinium contrast is what you need to remember. So, gadolinium is of high signal on T1 weighted, low signal on T2 weighted images. CSF appears dark on T1 weighted, bright on T2 weighted. You can remember black and white. मुझे black and white में बोल देना. So black means T1 CSF. When it is black means T1, white means T2 is what you need to remember. So in a T1 weighted, क्या होता है? CSF will be typically black in color. CSF is all T1 weighted. T2 weighted में it is white in color is the CSF. The best chest radiographs are performed at how much kVp? Between 90 to 120 kVp is what you need to remember. During angiocardiography, the mitral valve, how do you best visualize it? It is the right anterior oblique row is mitral valve. Otherwise, you can remember Rome, right? Right anterior oblique is mitral valve is what you need to remember. So this is how you can see the aortic valve, right? Now, PACS means what? Picture archiving and communicating system is called PACS. The most common format for image storage is DICOM. Digital imaging and communication in medicine format is what you should remember. So what are the least radiosensitive tissue and radioresistant? Bone and nervous tissue also. So organs with less need for cell renewal, like heart, skeletal muscle, nerves, are more resistant to the radiation effect. So whenever you are evaluating hypoxic ischemic brain injury, most of the germinal matrix hemorrhage occur within 24 hours of birth. HIE, hypoxic ischemic encephalopathy. How do you identify that? You do MR spectroscopy is more sensitive than diffusion weighted images. In MR spectroscopy, there is an increased lactate in the deep gray white matter in the parieto-occipital area, which is a very important indicator, is what you need to remember. So germinal matrix hemorrhages, which occur in the preterm babies who had intraventricular hemorrhages, is graded into GR1, 2, 3, and 4. Of course, really not needed to remember. So where do you see leather bottle? Yesterday only we discussed it. Leather bottle appearance of heart. In pericardial effusion, you see leather bottle shaped heart is what you need to remember. With regard to the tuberculosis, what is accepted about tuberculosis, doctor? Typically, cavitation, whenever it is there, it is the hallmark of post-primary TB. What is meant by primary TB? बचपन में पहले बार जब टीबी होता है, जब हमारा immunity first time recognized TB, that is primary TB. After that, post-primary TB. Post-primary TB typically presents with cavitation. Primary TB presents with Ghon's complex. What is Ghon's complex, doctor? Typically, there is a hilar lymphadenopathy, and there is one subpleural lesion. Together is called Ghon's. Ghon's is a feature of primary, and cavitation is a feature of post-primary TB. In TB meningitis, there is an abnormal meningeal enhancement, which is typically seen in the basal cisterns. That's the reason always TB meningitis, you need to give what? Dexamethasone. By giving dexamethasone, you are preventing the basal meningitis, and because of that cranial nerves, lower cranial nerves, palsy will be avoided. Similarly, in spinal TB, calcification of the abscess is very, very characteristic, doctor. In color Doppler, color depends on what? It is the relation of transducer to the blood flow. So anterograde blood flow, retrograde blood flow, ये दोनों मिल गया तो अगर mitral regurgitation है तो रंगोली होगा. That rangoli is identified by color Doppler is what you need to remember. So that brings us to the end of today's wonderful evening, doctor. Abhi 12 baj gaye. So to all my wonderful students, Madhu, Atul, Manish, Saurabh, everyone who is online, thank you all for coming, even if it is very late night. So रोज मिलेंगे, रोज पढ़ेंगे, एक दिन कामयाब होंगे. Download the Score Learning app. Also share it with all your classmates. And if you have not yet subscribed, subscribe today only. to the score app. Only 5,000 rupees if you pay. You get everything. 40,000 previous year question bank and 600 hours of video library containing 10,000 short videos, PowerPoints of all these presentations, daily live class, 100 full-scale grant tests and live discussion. Everything you will get just for 5,000 bucks. Tell your friends also to subscribe. They don't need any other coaching. Only they need Dr. Murali Bharadwaj and the Score app. Okay. And you order by paying another 5,000. We will courier you 1,200 pages notes to your home, which has 50,000 high yield facts, which you can use to underline, bookmark for your preparation. Thank you very much and see you all tomorrow.